Hi, I'm Dr. Steve Vensel. I'll be speaking with you today. I'm going to be addressing topics on how to distinguish the difference between healthy and unhealthy people, especially in volunteer leadership positions. In churches, they can wield considerable power, and you want to make sure you have healthy people in those places. So we're going to talk about that. I'm also going to give you a tool, kind of a coaching, counseling tool that's very effective in working with people in sessions as little as 20 minutes. It's very grounded, a lot of face value to it, and hopefully you'll walk out of here with something you'll be able to use, and I'll keep you out of the counseling office for those long-term clients. You can do some really good short-term work with them. So I look forward to seeing you today. I'll talk to you later. I will say one quick thing about the research that I've done, because I was debating on what to talk about today, and so I'm going to tell you what I'm not talking about first. But it's of great interest to pastors. What I'm not going to talk about is mobbing. Mobbing is when a small group of people get together and force someone out of the ministry. It's malicious, it involves lies and innuendos, it's incredibly destructive, and my research looked at that. I've established a research line that really looked at clergy, how clergy use the religious coping styles, and how mobbing, being forced out, can be part of the burnout process. So I looked at all of that, and so I'm beginning to compile more information. I'm now interviewing pastors to go a little bit deeper in terms of preventative measures. How do we get kind of abusive workplace behaviors addressed? So hopefully sometime in the future I'll be able to really put that together in a more cogent manner that I can really teach on. Today though, what I want to teach on and what I love teaching pastors about and people in ministry about is really distinguishing the difference between healthy and unhealthy people. You all have really governing boards, for lack of a better name, made up of volunteers in your church. Some of them wield considerable power. If it is an eldership or a deacon board, some of them might even wield enough power for hiring and firing decisions, financial packages, vacation, time off, I mean the whole 9 yards. And it's really important that in those volunteer positions you have healthy people versus unhealthy people. So I'm going to distinguish the two based on what we understand of people from a mental health perspective and in the literature. And then I'm going to give you a tool that you can use as either a counseling tool or a coaching tool that's very practical. You can use it in sessions as little as 20 minutes. You can use it with couples and individuals. And you can use it with people that don't have a lot of self-insight. You know, those people that just don't get it, right? Everybody knows who I'm talking about? We're going to be talking a lot about them today, because those really become the most destructive people, the most annoying people, the people that you go home and worry about the most or feel the baddest about the most. That's not much of a sentence right there, but so those are the things that I'm going to talk about. I'm going to give you a handout on that too. So the first thing about the difference between healthy and unhealthy people, I contend that life is all about relationship. It's all about relationship. We were born into relationship. Our relationship with God is restored by the sacrifice of His relationship with His Son. And so life really is all about relationship. All of the great moments in our life are usually shared in the context of relationship. When I defended my dissertation on Monday after a 4-year process, the first person I called was my wife, which, by the way, Monday, more importantly, was my 29th wedding anniversary. So it was a big day all around. So relationship is absolutely vital to who we are. In fact, we even know that babies that are born and don't receive touch and physical nurture, they may get food and water, but if they don't get touched, they languish and they can even perish. They die. That comes out of early research after World War II and during World War II. So relationship is really, really important. Then the next question becomes, what determines good and bad relationships? And it turns out that relationships really are all about problem solving. Because everybody can be in good relationship when there's no problems. So when there's no problems, we get along great, because there's nothing not to get along great about. Even sociopaths can have good relationships when there's no problems. And the literature on some of the great serial killers, how shocking their personal relationships were, either in their home or with neighbors that found them to be engaging, and we'll look at why that is. So you can fake some of that when there's no problems. But when there's problems, that's what really emerges in terms of certain people's capacities, abilities, and inabilities. So it's all about problem solving. Healthy people solve problems how healthy people solve problems is directly related to their emotional health and mental health. Because healthy people would rather be in a right relationship than have to be right. And so healthy people actually sacrifice. They learn to adapt. They learn to change. They learn to negotiate. And they learn in order to be in right relationships. So that's part of the healthy. But problem solving is the key. So we all have a problem solving toolbox. And the healthier you are, the more tools you have in that toolbox. So, and there can be hundreds of things. There can be humor. There can be avoidance. Avoidance is an appropriate, in fact, is even the best first tool to pull out when there's a problem. I'm just going to make believe it didn't happen. I'm going to let that go. Having a bad day, whatever it might be, avoidance is appropriate. Now, if you overuse that and it becomes appeasement or another tool that maybe isn't so healthy, you don't want to do that. You can have assertiveness, which is a good confrontational tool. So you can confront people. You can say, hey, the other day you said this and it kind of hurt my feelings or it was offensive in some manner. Tell me what you were thinking when you said that. And that's an appropriate solving problem tool. So the healthier you are, the more tools you have in your tool bag. So problem solving is related to the tools that we have. How do we use those tools? Well, there's three essential, I'm going to give you kind of the 4 crown jewels of mental health. Mental, emotional, and even, well, mental and emotional health. So I'm saying 5, but I mean 4. I'm going to give you the 2 rules. Because I'm a doctor now. So I want to give you these because these are essential to any problem-solving ability, also are essential into healthy relationships. Let me see, I'll go over here. The first tool, I'll give you kind of the 3 minor jewels, and then I'll give you the top crown jewel of all. But the first one is flexibility. Flexibility means a couple of different things. One is you pull out a tool and you try it and it doesn't get you what you want. So let's say you've got a bit of obsessive compulsiveness in you, you're newly married, and you say to your wife, you know, I would really like it if you would arrange the cans alphabetically. That's happened, by the way. And the wife says, you've lost your mind if you think I'm going to arrange the cans alphabetically. So flexibility would be the guy saying, you're right, that's kind of silly. I don't need the cans. In fact, don't worry about it. Okay, so you can be flexible. Sometimes you have to be able to look at yourself. We're going to look at that in a minute. Flexibility versus rigidity. The more flexible you are from a mental health perspective, the longer term relationships you have, and the quality of those relationships tend to be better. So the first is flexibility. The next is adaptability. So adaptability has a lot to do with what do you do when you've been as flexible as you can and nothing works? You keep reaching into the tool bag and it doesn't work. It doesn't work. It just keeps, well, you eventually adapt to that. Now, my professional standing, I've got over 20,000 hours of clinical time, and I do mostly marriage and family, mostly marriage counseling. And this, I always see one of the couples, one of the partners, tends to do more adapting than the other one. Which, if you think about it, that's normal. Because you typically have somebody that's in a more leadership position in relationships. Almost in all relationships, there's some hierarchy to some degree. Even in friendships, there'll be hierarchies depending on what the topic is. So my best friend is a pastor, so the hierarchy for him is anything theological, he's that leader, you know. Anything counseling, I'm that leader, and that switches back. And so you have these flexible kind of relationships, also with an understanding, though, that there are areas of leadership and areas of expertise and all of those kinds of things. But adaptability has a lot to do with how we use our tools and when we kind of give up certain tools and just either appropriately acquiesce to it. So, for instance, maybe there's some personality traits. My wife, as many wives, If there's a roach, within eye shot, she is very frightened by roaches. So no matter what time of the morning it is, if she beats me up, not if she beats me up, if she wakes up sooner than me, and I hear screaming in the bathroom, I know there's either an axe murderer in there because it would sound the same, or there's a roach. And so no matter if I'm asleep, no matter what I'm doing, I'm going to go get that roach. I've adapted to that. I ain't going to lay there anymore. Sleep is done. I will go get that roach, right? And I do it with good humor, and because I've adapted to it, and I can be flexible. So yes, I understand roaches are, that's like DEFCON, whatever. Get it? So there's adaptability, flexibility. The next one I'm going to share really is probably the most important of the four. So I got to write that down. Most important of the four. In fact, I'll put that last. So let me tell you what the top crown jewel. The top crown jewel is empathy. Empathy is a very recognized capacity that is really essential to healthy relationships. It's the serial killers that completely lack empathy. The name that we have for people who lack that capacity completely are sociopaths. However, it's also a continuum. We can have a little bit of it, or we can have a lot of it. Typically, people in helping fields, like pastors, like people in ministry, counselors, are pretty high on the empathy. And so we relate very well to people. We enjoy people. And at the heart of empathy, though, is this. The heart of empathy is, I don't want to hurt you because I've been hurt. And I wouldn't want to subject you to that I've experienced that has been hurtful. So I'm going to be cautious, careful, and respectful in our relationships. Empathy is what drives the whole notion of give and take. It's the understanding that there is reaping and sowing. That if I want my back scratched, I need to scratch a back. It's empathy that really drives all of your most important relationships or your deepest relationships. So empathy is that crown jewel. When you don't have empathy, you've really got significant problems. And you'd be surprised at how diminished that capacity is on people that you run into all the time. We're going to be looking at that especially. The last one, and this is the one that this is the easiest to diagnose people on in terms of, again, capacities. Capacities, if you think of capacities, it's like that pathway that I'm able to relate to you. And if my capacities are full, that pathway is very wide. We get a lot of information, a lot of relationship back and forth. The more restricted those pathways are, those capacities, the more restricted our relationship is. And healthy people will feel that. They'll pick that up in a sense of uncomfortableness, in a sense of need for boundaries, in a sense of, man, you're not a real safe person to be around. I bump into you and I experience you in a hurtful manner in some way. It's probably because your capacity is like this and theirs is like this, and you're going, you're focused on this, but it's so we'll look at that in a minute. That is, and it's this. It's called self-insight. Self-insight, I'll put these together in a minute. In the professional literature, this is called the reflective function. And this is a key essential piece, because let me tell you what it does. Self-insight allows me to ask and answer this question: what is the matter with me? If I can't ask what is the matter with me, what's the only other question I could ask? What's the matter with you? This is absolutely essential. And it's the easiest piece of the 4 jewels to discern. And you can find this out. And it's significant. It has a significant impact on people's ability to relate. What is the matter with me? If I can't ask that, and I can only ask what is the matter with you, that's going to lead into a lot of different problems. And I'll show you that in a moment. All right, so that's healthy people. So healthy people are flexible, adaptable. They make good use of self-insight, and at the deepest level, they're empathic. That's what healthy people are. Unhealthy people. Unhealthy people have diminished capacities in all of these. And we're going to look at 3 central kind of dynamics. You can think of them as tools in their toolbox. And in fact, we all have these tools, but everybody in here rarely uses these tools. assuming everybody in here is healthy, which, by the way, is a bad assumption. Because just statistically speaking, somebody in here got problems. So I just want you to know that. So, but you'll listen to this today, and it won't bother you because you have no self-insight. So, the first tool is kind of surprising because at first it sounds very appropriate. It sounds like a good thing, and that is the rescuer. However, the rescuer is a very manipulative type of tool because it always has strings attached. And I'll share what those strings are in a moment. We're going to be making a triangle here, just so that you know, so you can get this written out right. So I'm going to give you two more tools, and they're all attached, and I'll go through that. But the rescuer is always setting you up for something else. The rescue is a good thing that seems altruistic, but it's not. It's got its strings attached. And there's a couple of distinct personality types, narcissists in particular, that are really great at the rescue. Paranoid's very good at the rescues. I can be talking about some of the different personalities that lack those capacities. The next one, I'm going to come back to the rescuer in a minute. The next one is the victim. Now, it's okay to be a victim. In other words, all of us indeed get victimized at times. You can be bullied, you can be treated harshly, you can be lied about. There are things that are unfair that happen, and you truly are a victim. And for the most part in our society, we're not comfortable even with that term. We don't want to claim that too often, but it actually does happen. However, unhealthy people are the victim all the time. The next one is, and this is a little more complicated, but it is the prosecutor. I'll bring this all home for you in a minute. You can also be the persecutor. We can also call them the blamer. So prosecutor, persecutor, blamer. Now, here's how it works, because you can see, hear, and experience all three of these in a single sentence with someone. So I'll give you an example. So let's say sometime today in my talk, I say something really offensive. And during breakfast later, one of you comes up to me and says, Dr. Vensel, you said something and I was really offended by that. Now, if I'm a healthy person, I will say something like this, because this would be the most true, this would be the most likely scenario. I know exactly what you're saying. I was trying to be funny, and the words that came out of my mouth, I thought, oh, I hope nobody picks up on that. You're right, it was highly offensive, and I am so sorry. You reach into your tool bag, because you're flexible, and you pull out acceptance, and you say, you know what, I appreciate it, that's good enough for me. Problem is solved. We now have a restored relationship, and we go forth. So that's appropriate problem solving, and my response was none of these. My response was confession, was contriteness, so that was my response. However, what if my response was this? Hey, you have no idea how much effort I had to put into being here today. I came all the way from Fort Lauderdale area to be here today. And the hair stands up in the back of your neck and you think, okay, that's weird. What does that have to do with me being offended by what he said? That's me being a victim. Or I say, you got a lot of nerve talking to me. I'm a doctor, right? Because I can say that. Yeah? You got a lot of nerve saying that to me. Do you know how much experience I have with this? I know what I'm talking about here. And again, the hair goes up in the back of your neck and you think, that's really creepy. Because one is, he's not addressing the relationship issues at all. In fact, he's kind of making it worse. And now you've got to either go in and up your tools, right? You got to go get a power tool now, okay? Or you got to say, you know what, this guy's weird. I'm just going to back off because I'm going to be here another 10 minutes and probably will never see him again. And so you'll very quickly decide which one is the way to go. And the fact of the matter is I just made a problem worse because I was this. What you see in people is you can hear all of these. So I'll give you an example. I got a call from a female, from a gal. She says, we need to come in. My husband and I, we've been married 5 years. He was under tremendous debt when we got married. And over our first 3 years, I was able to get rid of that debt, take care of that. And we need to come in to talk because his spending is out of control. Okay. So they come in, I do the thing that all counselors do, confidentiality and all that. And then I say, why are you here and how can I help? And I always just say that to whoever's there. Anybody can start, and it means something, but anybody can start. So why are you here? How can I help? She says, well, as you know, I called you and I'm very concerned over my husband's spending. We were under tremendous debt when we got married, and because of my efforts, I was able to pull us out of debt, and now he's spending, and I'm very concerned. But she goes on for the next 20 minutes, kind of reiterating that, and I'm just listening. He, in the meantime, is sitting very quietly. He's attentive. He doesn't interrupt. He's making eye contact with me, occasionally eye contact with her, very respectful. She finally gets done. I say to him, why are you here and how can I help? And he said, well, he said, I don't think my spending is out of control. I mean, some of what she said was true. And I said, well, tell me a little bit about, she said that you were under tremendous debt. I'm kind of curious, what kind of debt did you have when you came into this marriage? He said, well, I had a credit card that by the time we got married had $5,000 on it. I said, oh, okay, how many credit cards did you have? He said, no, just the one. I said, okay, and what other debt? Did you have a car? I said, nah, my car was pretty much paid for. I had another 3 months and it was paid for after we were married. I said, so $5,000 on a credit card? What was on that credit card? And he said, really most of it was, I had about a $2,000 balance on it that I kind of kept there because that's good for credit rating. And then we put the rest on for wedding expenses. And I looked at her and I said, you said you had tremendous debt. She said, yes. Okay. So I'm thinking that doesn't fit, right? Anybody here think $5,000 is tremendous debt, right? You should think that, but that's okay. So I say, okay, so tell me a little bit about your spending. Well, he's dressed and he's got a polo shirt on. And he says, well, I bought this shirt. I said, that's a very nice shirt. How much that shirt cost? It said it cost like $80. I said, how many of those did you buy? He said, no, I just bought this one shirt. Okay, what else have you bought? So that's pretty much it. See, I'm thinking electronics, computers, you bought other things. He says, no, that's it. So I look at her and I say, well, so the $5,000 debt was really not tremendous, and you're telling me this is the thing that he bought? She says, yes. And so I say to him, I'm curious, how much money a year do you make? So they make about $150,000 a year. So here's what was happening. So now I'm going to go back through that. We got married. Oh, and by the way, with really unhealthy people, when we talk about people with underlying personality disorders, they have distorted perceptions. How they see reality is different than healthy people. And so when you hear this, you think it's audacious. You think it's like just crazy, which it kind of is, not clinically speaking. But it really doesn't make sense. There's such a disconnect. That's because they have distorted perceptions, but they believe what they perceive. And so it's difficult for healthy people to be in touch with them or to be in contact with them because their perception of things, especially if you've had an argument with one of them, is bizarrely distorted. And it's always distorted in their favor to keep them here, by the way. So when we got married, we were under tremendous debt, and I was able to pay off the debts. That's the rescue. Because of me, we were able to pay off that debt. Now I'm concerned my husband is up to his old tricks. And if he thinks that this marriage can survive with him spending like that, we have children now and things need to change. That triangle, these go back and forth. This is not a problem-solving process. This is referred to as the drama. And you will get sucked into the drama faster than you can imagine. Now, for instance, when we talk about personality disorders, so personality disorders are, and some of you buy into diagnoses, some of you don't. Let me tell you why I buy into it. Essentially, a diagnosis came about this way. It was a group of professionals getting together and talking about their work. It'd be the same as pastors getting together and saying, hey, I spend a lot of time in premarital and, I see different types of couples come in. And another pastor says, you know what, I experienced the same thing. Let's talk about it. And you start talking about those couples. and you realize you start sharing about a couple, and the other guy or gal says, you know what? I've got a couple just like that. Same kind of dynamic. And you decide, instead of saying, hey, remember that couple we talked about 3 weeks ago? You give them a name. You give them a name of, we're going to call them the self-centered couple. And so you begin kind of categorizing people, and that's all diagnoses are. That's all it is. It's at a pretty professional level. It's at a clinical level. Hopefully it's at the whole new diagnostic manual coming out that's highly controversial for a lot of these reasons, because doesn't have a lot of good research on it. But that's all diagnosis is, that sense of professionals getting together and trying to categorize dynamics that they're seeing that have the similarities. So when we talk about personality disorders, we're talking about people that have an inherently difficult time relating to other people and solving problems. And they are rigid, they make other people adapt, and they have no self-insight. So with this couple, I hear that drama, so I say to them, I say to her, well, let me ask you this. Tell me something you bring into this marriage that you need to work on. You know, it could be a piece of your baggage, but a thing that you know drives him crazy. And she says, I think I'm too loving. And I go, ha ha! And she didn't laugh because I forgot that her distorted perception is she believes that. And she was offended by that. I said, I'm sorry. I said, I thought you were joking, but you're not. Well, I said, yes, all that clinical experience and you still screw up. So I said, I'm sorry. That's really a strength disguised as a weakness. Give me a weakness. Give me something that you need to work on. She says, I don't have any of those. Okay. I say to him, how about you? What's something you know you need to work on? So I'm looking for self-insight. Because remember, self-insight is going to be what drives the problem-solving process. Here's why. If you can't admit you have a problem, you can't change it, right? I think it was Einstein said you can't fix a problem with the same kind of thinking that started it. Unless you can challenge that thinking, and you're only going to do that through some level of self-insight. So I say to him, how about you? And he says, well, I know I can be pretty avoidant, and I let things slide. And that's a high-level self-insight. That's him saying, my avoidance at times causes more problems, doesn't fix problems. It may not cause more, but doesn't fix problems. And I said, well, tell me about your avoidance. When do you use that? And he says, well, I use it a lot. Well, now what we've jumped into is an adaptability issue. When you see highly either avoidant, it might be part of their God-given personality, but it might also be an adaptation. In this case, it was an adaptation. She was actually relentless. I diagnosed her with what's called obsessive-compulsive personality disorder. Now, let me talk about personality disorders. And by the way, you're going to see a preponderance of obsessive-compulsive personality disorders in the church. These are your highly legalistic people, highly rigid, but also highly organized in their thinking. And they will absolutely challenge you and win on almost any of the theological issues. And you walk away going, okay, I know they're right about some things, but they're so wrong. This is so wrong in terms of this process. Well, and this is why. It's a very disordered process. So with personalities, it's really a continuum. And we know that there's these kind of three segments. And over here is full-blown personality disorders. Now, let me just tell you what that is. Oh, man. A personality disorder is this. It's called a pervasive enduring pattern. So it's pattern all throughout their lives. And it has to do with problem solving. And so it's this pattern of personality that is different from the norm and different from other people. In the diagnostic manual, there's two huge broad categories, and they're called axes. And axis 1 disorders has hundreds of disorders on it. It's got depression and bipolar, it's got schizophrenia and substance abuse. I mean, every diagnosis actually every diagnosis except 2 is an axis 1 disorder. Axis 2 disorder only has 2 on it. So axis 1, hundreds. Axis 2, only 2. One of them is personality disorders, and the other is mental retardation. Now you have to ask, why is that? What do those two things have in common? What they have in common is this, is if you're mentally retarded, you don't have symptoms of mental retardation. You have characteristics. If you're mentally retarded at 3, you will be mentally retarded at 30. And so what treatment for mental retardation is it's not treatment curative, it's treatment in terms of management, maximizing their potential, filling out their capacities and discovering those capacities to whatever they are. But they're always going to be mentally retarded. People with personality disorders, it's considered pervasive enduring. They don't have symptoms, they have characteristics. This is the characteristics that they have. That when it comes to problem solving, they are the rescuer, again, we'll come into that in a moment, the victim or the persecutor. And then there's also a continuum. You can be full-blown personality disorder, or you can be personality disorder-ish. We call these styles, personality styles. So obsessive compulsive disorder, personality disorder, unfortunately has a similar name to an axis 1 disorder called obsessive compulsive. And that's an anxiety disorder, so everything needs to be ritualized, and there's an anxiety, if something's out of place, there's an anxiety that builds, let's get it in place. Oh, now we feel better. Obsessive compulsive personality disorder isn't about anxiety. It is about an over-adherence to rules, protocols, and policies. These are the very rigid people that this is the way it's done. And they have a very difficult time stepping outside of that realm. So for this gal I had talked about, her spending and her need for control, money is spent this way. Money is not spent on your own, even if it's for one shirt. One shirt means more than one shirt, because you stepped outside of the rules that I set. And the rules are that all spending goes through me. And because he acquiesced, that was what he just finally got tired of it. What he finally said in therapy is, hey, you're not in control of the money, you manage the money, and there's a big difference. We had to help them work through that, which was not real successful, because she was actually pretty significantly disordered person. That she couldn't really understand how she was not right. And the thing with obsessive compulsive is usually their arguments, they really are right. They make great employees. They make great managers as long as you have a lot of turnover. You don't mind a lot of turnover. But all the forms will be filled out right. Everything will be in compliance and adherence. They really do very well in certain jobs. Another type of the rescue is the narcissist. Now, here's what I learned about the rescue. Let's say let's say it's Sunday morning, you're headed to church, of course, and you're on one of the major highways there, I-4, I guess, and you have a blowout. And you pull over and you get out of your car and you're thinking, oh man, I'm trying to get to church. Some guy in an old panel truck pulls up behind you and says, hey, let me change that tire for you. It looks like you're headed to church. And you're like, oh, thank you so much. Guy changes your tire in about 5 minutes. You pull out your wallet or your purse, go to hand him $20. The guy goes, no, that's my good deed for the day. Pay it forward. You got rescued. Same scenario, blown out tire, guy comes up, changes the tire. You pull out your wallet or your purse, go to give him $20. He goes, no, I don't want your $20. Give me your purse. Give me your wallet. And grabs your wallet, throws your keys in the bushes, and takes off. Now, you got rescued. But the bottom line is that the rescue was exploitive in nature. Her handling the money was exploitive in nature. Her handling the money served the purpose basically to get her mostly back to this. So problems were solved in this rigid need for control in that case. But you see it in all different ways. There's about 9 different personality disorders, but the thing that I want you to capture is really this. When you see people that have limited self-insight, are inflexible and unadaptable, make others adapt to them, you're going to know it. And go back and listen to what they say and see if you can categorize it in one of these. Now, I'll do one other thing. Without over-spiritualizing, you're David. How do you want to be remembered in life? Just what's the first thing that comes to mind? Honest, okay. Dave's existential identity, the way that he purports himself in life, the things that he values, and the things that he makes sure are available and part of every relationship he has is honesty. That's his existential identity. And all of us have that. And the easiest way to discover it is just to answer that question. Don't over-spiritualize it. I want to be known as a great Christian. No, just how do you want to be in relationship with people? And typically it'll have some relationship quality to it. In fact, when people say, I want to be known as the greatest builder of, they're probably narcissistic. And because they lack self-insight, They probably think that they're incredibly honest. They probably think that so you typically will hear, things that are about their accomplishments as their identity. What's interesting is that your identity of being honest is what drives you and how you purport yourself. People with underlying personality disorders or personality styles, their existential identity is either the rescuer, the victim, or the persecutor. That's what drives them to purport themselves in their relationships. So they don't solve problems and make problems worse. Because you can't solve a problem and be a victim. You can't solve a problem and be a persecutor or a prosecutor. So they typically don't solve problems well. That means that when you have somebody in a leadership position, when there's not problems, you cannot distinguish. Somebody with a really fairly heavy, a 6 or 7 level personality disorder can come in and I can sit with them individually and I will never know. You cannot diagnose or even get to know this dynamic without there being problems. Now if I start asking them about their relationships, and you hear them talk about their relationships, this will emerge pretty quickly if that's part of the dynamic. But for the most part, you can. But not only that, when somebody is a victim and they come in and they meet with you and they say, I don't know who else to talk to. Oh, okay. Man, my wife or my husband has been doing this and has been doing this and they do this. Within a few minutes, you're going to feel very compassionate about that person. You're going to absolutely believe everything they tell you. Because of distorted perception, they'll believe everything they're telling you. But then you will sit down with that spouse, and within about 20 minutes, you'll think, I had no idea. I had no idea what this person was really experiencing. And you go, how can that be? Well, that's that distorted perception. So whenever you're doing couples work, whenever you meet, you've got to have that balance. I basically teach my students, don't ever believe what an individual tells you. It's not that it's not true, it's just that the conclusions about it may not be true. That our conclusions that we reach about people are very subjective. If I tell you about an argument I had with my wife or somebody, who's going to come out looking pretty good in my narrative? Yeah, of course it's going to be me. Why else would I tell you about it, right? So just always keep that in mind and keep looking for this.
I had that couple last night.
Yep. Yep.
To the T.
Okay. Well, here's a way to bypass some of this. Let me just have you hand some of those back. And I'll spend just a few minutes on this. I think that'll get everybody there. Some are coming back that way. I do a class on this, so I don't know if I've hit everything I really want to hit, but I think we've got it good enough. This is actually my rendition of a therapy that sounds scary to most pastors, so I renamed it Situational Debriefing. The technical name is Cognitive Analysis System of Psychotherapy, and that freaks people out, so I call it Situational Debriefing. It is a type of cognitive behavioral therapy. Now here's what I like about cognitive behavioral therapy. Cognitive behavioral therapy is about what we think, our beliefs, our conclusions, impact our relationships and our behaviors and our feelings. And you can intervene at any point in terms of cognition or thinking, our behavior or our feelings, and kind of get things switched up there. That's cognitive behavioral. And I think that's very congruent with Scripture. Because Romans talks about be transformed by the renewing of your mind. Ephesians talks about be made new in knowledge. And so this idea of how we think can really impact how we feel and how we behave. This is a type of therapy that you can use in very quick sessions. You can do 20 minutes, and this works great with teenagers, works great with people with underlying personality disorders. It bypasses the need for self-insight, which is interesting. And most therapy, by the way, the reason these kinds of people kind of never get better, it's that pervasive and enduring, because most therapies are insight-oriented therapy. Most therapy that's effective, why are you here and how can I help? And if you're here because so-and-so is that or so-and-so in this, then the therapist doesn't have a client they're working with. All the clients are all these other people. So they will give session time to them, but nothing ever changes. This can really impact that. And so what you do with this is kind of a past-oriented type of therapy. In other words, somebody's going to come in already having had a problem, already having had something that turned south. It's the kid that comes in and says, yeah, I got suspended for smoking in the bathroom, or I got suspended for fighting. It's the couple that comes in, they've had this big fight, they yell and scream, and they've said vile things to each other, and I'll take you through one of those that I use this on. So what you are doing is you're debriefing something that already took place as training to help them respond differently for something that will take place. And so it's situational debriefing. So you have to have a problem that's coming in. So it's about something that happened, learning from it to change the future. So the first thing is describe what happened. So this is a real life scenario. Fairly narcissistic husband. He comes in and the story is, yes, I worked late. I worked till about 6 o'clock. I came home and all I really wanted was to have dinner waiting for me. And I come home and the place is a wreck. My wife is nowhere to be seen. There's no dinner. And I come home and I go, great. What a bunch of lazy people. And then what did you do? Well, I go to the bedroom. My wife's laying down. I said, you know, if you weren't so lazy, everybody'd be fed by now. And then what happened? My wife screamed at me. She says, you're clueless. She slammed the door. And I ended up eating McDonald's that night and sleeping on the couch. So now we go back. That's what happened. That's his narrative. So we go back and we look at step 2. What was your interpretation or thoughts of the situation? And so he comes in. So I say, well, you said that when you came in, the place was a wreck. And your first thought was what? My first thought was, everybody's a bunch of lazy, whatever he said. All right, so everybody's lazy. And then what's the next thing you did? Because you look there and you get, by the way, in terms of step 2 and 3, your interpretations or thoughts and your behaviors as verbatim as possible. So you just want to hear their words. Their words are going to be more effective to remember to change than your words for them. So let them struggle a bit. Let them remember. And then talking, you know, if a person comes in and says, well, like for instance, this guy, if he said, oh, I let her know how upset I was, hey, that's not your behavior. Okay, that's what you're thinking. What did you actually say to her? Well, I walked in the bedroom, she's laying down. You're going to be surprised by this. This is a real story. She's laying down, and I say, you need to get off your lazy butt. You didn't use the word butt. And cook dinner. So that was what he said, and that was verbatim. Step 4, what did you do? What did you want to get out? What was your desired outcome? What were you hoping to get? I just wanted dinner. I wanted dinner with my family. Okay, that's step 4. Step 5, what actually happened? She screamed at me, she slammed the door, and I ate McDonald's. So that's the first 5. So, a narrative of what happened, what were your thoughts, what were your behaviors, what was your desired outcome, and what actually happened. And then you say, and did you get what you wanted? Nope, didn't get what I wanted. The whole rest is going back now and coming up with a new scenario. So step 7 is, you ask, would you like to look at the situation? Can we look at, you say more realistic, you say, hey, let's go back and look at this together and see if there's some alternatives for you. See if maybe there's something you could have done different that would help you get what you want. Now remember, self-insight oriented would sound like this. Wow, why do you think she threw you out of the bedroom? Maybe you were being a horse's butt. That's a clinical phrase, by the way. That's self-insight. Somebody with limited self-insight would say, hey, she was the one that should have had dinner. And you'll push back on that. And you'll think, man, how do I do this? So this is the way you do it. So what did you want to get? Well, I wanted to get dinner. Okay. So your first interpretation is everybody's lazy. Did that interpretation help you or hurt you get what you want? And you see down there, interpretation help you and hurt you. The conclusions you reached about dinner not being on the table, you said the place was a wreck, everybody's lazy. Did that help you or hurt you? Well, that probably didn't help me because I got angry after that. And you'll see there's a connection between your interpretations and anger. Because by the way, events never cause emotions. It's our belief about events that cause emotions. So when he came home, and you're going to be shocked at what the reality was going on here. But people with underlying personality disorders don't get it. And so he says, well, that really hurt me because it made me angry when I thought that. Okay? What's an alternative? What's a different way of thinking? And he says this. He says, well, I knew my wife had the flu. Right? You would think, Mr. Compassion, you know, it's like Don Rickles, you know. Well, I knew my wife had the flu, and so did one of my kids. So she was probably tired. Had you had that thought, would that have helped you or hurt you? That would have helped me, because then I wouldn't have been angry. Now that sounds pretty elementary, but everyone in here is nodding. We deal with these people. You deal with these people. You know, pastors are, you look at the history of counseling, pastors are the first best counselors. You get this all the time. Now, I know most of you don't want to get bogged down with this. Most of you don't want to do therapy, so you refer out. This is a way to get started. And you can do this in as little as 20 minutes. So, all right, so if you had had that interpretation then, and I think we're now on step 8, you can ask for additional ones too. What's another interpretation? If I had had that interpretation, well, I could have also realized that, you know, maybe I could have called home and said, hey, would you like me to pick something up for dinner? You know, so if he had that interpretation even before. So, and then step 9, and then you go to the behavior. So your behavior was you went into the bedroom and you said something derogatory to your wife about being lazy. Did that help you or hurt you get what you wanted? Well, that definitely hurt me. That didn't help at all. What's a behavior that could have helped? Well, I could have said, hey, would you like me to go out to get something because I know she wasn't feeling good and there's no way that she's going to cook and I'm not going to cook. So I probably could have gone out and maybe gotten something nicer than McDonald's for everyone. And would that have helped you? Yes, that would have helped me. Well, maybe next time, this situation, you can think before, you know, you feel. So when you come into a situation, think, ooh, what's my interpretations? What's my conclusions about this? Is that a good conclusion? Is that going to help me or hurt me get what I want? You do this about 3 or 4 times with people, and they begin getting it. And so the idea of working with people with underlying personality disorders, you actually help them begin to mimic healthier people. You don't change them, but you get them to mimic it. It's based on, it's still based on this very manipulative process, but you're teaching them to manipulate people in a healthy manner, if that makes sense. Instead of yelling and screaming and getting in my way, you're just bypassing, replacing what would be healthy self-insight with what is civil behavior, right? What is appropriate, polite behavior, even though it's still based on what I get. And it can offer considerable relief to couples, by the way. So this is a very good technique. It feels awkward at first, but keep this and start practicing. It works great with teenagers, works great with younger kids too. And there's a lot of different ways that you can use this, but hopefully that's helpful to you. I use this quite a bit actually with those lower functioning couples that, you know, kind of have some of this process. So what I would like you to take away is not only that, but really become adept at seeing this drama. When you're hearing people, and man, I pick up on it right away. It's so easy to hear, oh, that's the persecutor or the prosecutor, that's the victim, that's the, you know, I've worked with another obsessive compulsive mother that had a drug-addicted adult daughter. And one of the things she said, and she was using drugs for all the right reasons, because the mom had this was a very disordered family. Dad was super avoidant, gambler. Mom was super obsessive compulsive, loved by all in her. She ran a medical practice. She wasn't a physician, but ran the practice. But she said, I didn't buy you a car so you could just go anywhere you want in it. Wasn't that why you buy somebody a car, right? I mean, so that's the rescue, and she was the victim. And she played this all the time. And so that drama, you'll hear that in a lot of different ways. When you encounter people and you think, you know, there's not a lot of give and take here. There's mostly take. That's a sign. When you get kind of twisted up, because what happens is we try to overlay our own mental health and emotional health on people. And so we tend to be more adaptable and flexible. And so you kind of give that to people. You think, maybe they were having a bad day or maybe that. And my encouragement to you is get real adept at hearing this very soon. One of the best things you can do for leadership positions is before anybody comes on, and every church is a little bit different, but if you have strong leadership positions that wield considerable power and make significant decisions in your church, I would tell you to begin to do encounter groups for anybody new coming on. And part of the encounter group will be focused on that conflict resolution and focused also on their own self-insight. So that there has to be some level of vulnerability where they have to be able to express, here's areas in my life that I need to work on, both in my family and in my personal relationships. And begin to assess how flexible and adaptable they are and whether they have any useful self-insight. So these pseudo self-insights like, oh, I'm too generous, or I'm too this, or I'm too that, those don't cut it. Those are either very narcissistic statements or statements of people that have very limited self-insight function. And so that's one of the best things you can do is, even though that sounds touchy-feely, in effect it is. Because think about Christian ministry. At the heart of Christian ministry is servant, right? It's a servant. There's a servant nature to it. It's not about corporate America. It's not about wielding authority over people. It's about people in authority wielding it up underneath so that ministry and care is taking place. If they don't have self-insight, I guarantee you that authority will eventually become like this. And so many of our church boards are made up of successful people in the community. But that's a whole different paradigm than a scriptural paradigm. So I just caution you with that. This to me is the real money maker. That you can really begin to get some sense of how well will people do in leadership positions. You know, will they be of like mind? Because you get somebody with a personality disorder, they don't solve problems. So things like adaptability, negotiation, and all of those things, that's on a whole nother playing field so they can keep with the drama. And then lastly, I'll say the worst thing you can do is jump into the drama. And so many therapists, including myself, it's so easy to get trapped in this. Because you want to go, oh, wait. Don't you understand? And they don't. And so you get trapped into this. And so this is where you can spend a lot of time. So hopefully that will be helpful to you. I think I'll stop here. And thank you.
Any questions?
Yeah, questions. Yes.
Doctor, this looks like a really good screening tool to recognize who's who. But I don't hear from you a lot of hope moving from the left to the right. Do you have good hope for seeing these people with personality disorders changing?
Here's what we know. We know on this continuum that when you get down into this lower level, and I don't know how to explain this non-clinically, but these are really workable people. So that they have this, but they also have some of this. This really is the key. If people are able to say, look, I know I can be a jerk at times. That's helpful. Because then I will have you write this down. This is a very practical way of working with people that can be rigid but have some insight. It's a definition of a weakness. A weakness equals the difference between, I'm trying to remember the rest of it. Oh, I'm sorry. Scratch that. A weakness equals, got brain fade here. It's the abuse, misuse, or overuse of a strength, not the difference. A weakness is an abuse, misuse, or overuse of a strength. And so if somebody is commanding, they can be controlling. If somebody is patient, they can be aloof. If somebody is easygoing, they can be lazy. If somebody is social and warm, they can be the bore. So that it's a weakness is an abuse, misuse, or overuse of a strength. And that works very well helping people if they have even some limited self-insight, like that statement of, I know I can be too strong. Using that and being able to coach them in that kind of setting, like an encounter setting in the beginning is, all right, if that's true, then that means in our session meetings or in our eldership meetings, our diaconate meetings, whatever that is, that means your area of weakness is going to be controlling, to be this or to be that. So that's a really practical tool, that definition of a weakness. And people will generally that are somewhat healthy will jump onto that, and it will help them with that insight process, and you'll have a good sense. You'll be like, okay, that's legitimate. Up here, so in answer to your question is we can generally take a 5 and move it to a 4, a 3 and move it, but these are really strong demarcations here. And my belief is that no, you don't cure it, you help them manage it. And it really has so much to do with these two in particular, the empathy and the self-insight. And you know, if they've got long-term marriages, that's probably they're probably down here, so they're pretty workable. This is as good as I can do for you. Any other questions? Yes.
You stressed empathy and self-insight. I was just thinking about self-insight in particular, that it has to be something that keeps growing. One never plateaus that you have arrived. It's like a constant engagement. As whatever field you're in, you have to keep, looking inside, scrutinizing, because it helps to put things, I believe, in the right perspective. Correct? And then the matter of empathy,
Before you go to empathy, one of the things I would say is the opposite of self-insight is arrogance.
Yes. Yeah, I was reading something about empathy, and it talks about great leaders are empathetic. Generally, they might not have all the tools of the know-how of, say, a particular job, but by being empathetic, it puts them in a better leadership role. Does that make sense?
It can make sense. The kind of an opposite view of that, because I think that's emerging. I'll leave that kind of to the leadership guys that can talk more to that and transformational and servant leadership. But I know that when we talk about narcissists, high functioning, kind of superstar narcissists, do tremendous amount of social good because they're constantly in rescue mode, but it's usually rescue to large groups like single moms or children or the unsaved. And so people in large ministries, large corporations, probably at the helm of that have some level of narcissism. But God uses that in a mighty way. If they have some level of insight, that's helpful. But narcissists have a drive and an ability that most of us don't have. And they're very obnoxious, but they do great social things. So there's a balance. It's one of the few personality disorders that has, obsessive compulsives have some positives about them too, but some of the other ones not so much. Okay.